The healthcare market this year has seen a fair amount of disruption. Insulin price caps, Medicare price negotiation, and a Mark Cuban-funded startup aimed at lowering drug prices. Now CVS Pharmacy is announcing it will overhaul the way it calculates prescription drug costs. The new formula will be based on the list price CVS paid the drug maker, a fee for pharmacy service, plus a standard markup. CVS says the new system is simpler and more transparent than its current one. Here to help us understand what, in fact, that means for consumers is Tina Reed. She's a senior healthcare reporter at Axios. So how is this different from the old system? And the question everybody wants to know is, will their drugs be cheaper?
So the old system was much more complex, very opaque. This offers transparent pricing, and CVS told me they believe the price of most drugs will drop at the pharmacy counter, although they acknowledge some may actually go up, and it depends on how it shakes out. But they also said they're expecting less variability in drug prices.
And so that means, I guess, less variability means people can plan on and expect their drug prices for a long period of time to be sort of at the same level. Is that what that means?
Yes, and one of the bigger changes this will have is really more in the commercial market when it comes to that in 2025. When employers are contracting their health plans, a lot of times they're not able to actually see how much the drugs actually cost that are part of their formulary. So this should offer them more transparency, which should then help consumers better understand and know what they're going to be paying.
What's in this for CVS?
So CVS actually said that this will help their bottom line. It's been a tough year for retailers, and CVS executives said they were actually expecting a 5% drop in adjusted operating income next year, and this will actually help flatten that income.
And what about pharma, drug makers? If the prices are more transparent, does that then shift eyeballs to where the big costs are in some cases, which is the drug companies?
It may. I mean, this is clearly a response to some of the scrutiny and pressure that a piece of the market known as pharmacy benefit managers, they're the middlemen between drug manufacturers, insurers, and pharmacies. So if they're sort of starting to take a look at their business practices, it definitely is going to sort of impact or have ripple effects throughout the drug pricing structure.
And is the expectation that other drugstores would follow suit with what CVS is doing, or that this is a way for CVS to create some sense of competition so people who might like the transparency come get their pharmaceuticals from them instead of, say, Walgreens or someone else?
Well, this seems to be part of a bigger move within the industry that's already happening. Mark Cuban obviously had his cost plus drugs and started this sort of pressure towards more transparency, but we've seen smaller players in the market using this sort of pricing, this sort of transparency. And Cigna and Express Scripts, which is another one of these middlemen, announced last month they would be offering a similar option. So it appears the industry is really responding to market pressures and pressure on Capitol Hill.
And is there a white whale out there for reducing pharmaceutical costs and lower prices? Is there some big option that's out there that isn't being tried?
Well, the big focus of the scrutiny has really been on rebates, and it remains to be seen what happens to what are known as drug rebates, which essentially allows drug manufacturers to work out a deal where they get better placement on a formulary, so they get their drug covered, and maybe a lower priced option doesn't get made available to consumers on by their insurance. So drug rebates are really going to be the thing, I think, to watch.
All right, we'll keep our eye on it. Tina Reed, senior healthcare reporter at Axios. Thanks so much for being with us.
Thank you.